Welcome to COVID-19 Habitat Touches and You. We will build safely together. The information in this slideshow is a combination of information from the CDC, OSHA, and Habitat for Humanity of Dutchess County. Infection with SARS-CoV-2, the virus that causes COVID-19, can result in a range of illness from mild symptoms to severe illness and death. We don't know how SARS-CoV-2 will affect each person. That is why here at Habitat Dutchess, we've put protocols in place to create a safe environment for staff, volunteers, and customers. Protocols include, but are not limited to, screening staff and volunteers upon entering a site. When you enter a work site or restore, you will be asked to take your temperature, sign in, and answer COVID questions. A mask requirement, restrooms for volunteers and staff only, weekly professional service, cleaning, sanitation options easily available, such as the Ecolab peroxide spray and Clorox 360 sprayer. Donation pickups are outside only, and social distancing is a requirement at both restore and on work sites. If you have any concerns regarding the Habitat Dutchess COVID-19 protocols, please complete our anonymous report. The link is located on this slide and a few other places in the slideshow. There are many ways to help prevent the spread of COVID-19. We will review some of these items in depth in the following slide, but please take a moment to read all of the ways based on the CDC's recommendations. Wearing a mask is wonderful, but if you are not wearing it properly, it is not helping to prevent the spread of COVID-19, and it is not protecting you from contracting COVID-19. Your mask should be snug, 2 layers thick, and cover your nose and mouth from the bridge of your nose to underneath your chin. As our dog friend is illustrating, there are correct ways and incorrect ways to wear your mask. Please note, children under the age of 2 are not required to wear a mask. An easy way to help prevent the spread of COVID-19 is to wash your hands. 20 seconds in warm water with antibacterial soap is the best way to keep your hands clean. Be thorough and wash from wrist to fingertips. Cleaning and disinfecting surfaces daily with EPA-approved cleaning products is critical. Surfaces to clean can include high-touch areas such as bathrooms, common areas, handles, countertops, pens, light switches, desks, keyboards, phones, anywhere that is touched often. Ecolab spray can be found throughout our building at Restore in clearly marked bottles in common areas such as the break room, restrooms, and registers. To use the spray, mist it about 1 to 2 feet in the air over your targeted area and allow it to sit on the surface. It is safe for cloth and other materials, can be used all day, every day. Our Clorox 360 sprayer is electrostatic and needs to be used by people who are trained. The sprayer is used in our donations area as well as high-touch areas in mornings or evenings. According to supermarketnews.com, retailers need to be thinking of ways to inspire a sense of safety for consumers, going beyond offering gloves and masks at the door. Spraying and cleaning is a great way to inspire a sense of safety for consumers by demonstrating the safety that we have in place. We are up to date on our CDC symptoms and check the CDC website often to make sure that we are staying up to date. If you think you may have a symptom or symptoms of COVID-19, don't panic. Many symptoms cross over into other illnesses such as the common cold or food poisoning. However, do not come to Habitat Dutchess. If you are an employee, please call your supervisor and inform them you're taking precautions for COVID-19 and be sure to follow up. You may be asked if you're positive or have come in contact with a positive person. Please be honest so that Habitat Dutchess may follow the necessary procedures. Please follow all Habitat Dutchess protocols, which are based on the most up-to-date CDC recommendations. You can find the protocols here on this link, or you can find them printed by any volunteer staff screening sign-in area. Isolation versus quarantine. Isolation is when someone is positive and they must isolate, including limiting all contact even within their household. Quarantining is when someone has been exposed to COVID-19. They must quarantine or remain away from the public work environment. Someone should quarantine if they have been directly exposed. Examples of close contact include you were within 6 feet of someone who has COVID-19 for a total of 15 minutes or more within a 24-hour period. You provided care at home to someone who is sick with COVID-19 or had direct contact with someone, such as hugging or kissing a positive COVID-19 person. You shared eating or drinking utensils with someone who is positive with COVID-19, or a person who is positive with COVID-19 sneezed, coughed, or somehow got respiratory droplets on you. Habitat Dutchess is a retaliation-free environment. It is safe to report both illness and concerns when it comes to COVID-19. This website on this slide is for COVID-19 anonymous reporting and for COVID-19 safety concerns only. Please do not report positive cases of COVID-19. The anonymous reporting is also printed and available at the volunteer and staff screening area. COVID-19 vaccination is a safer way to build protection. Getting the virus that causes COVID-19 may offer some natural protection known as an antibody or immune, but experts don't know how long this protection lasts. The risk of severe illness and death from COVID-19 far outweighs any benefits of natural immunity. COVID-19 vaccination will help protect you by building immunity without the risk of severe illness. Key facts about COVID-19 vaccination. Getting vaccinated can help prevent getting sick with COVID-19. People who have already gotten sick with COVID-19 may still benefit from getting vaccinated. COVID-19 vaccines cannot give you COVID-19. COVID-19 vaccines will not cause you to test positive on a COVID-19 viral test. For more information, please visit thecdc.gov. COVID-19 vaccines are being held to the same safety standards as all vaccines. Please read this slide to find out the process of how the FDA reviews vaccines and helps to keep us safe. Getting a COVID vaccine will help create an immune response in your body against the virus. It may also keep you from getting severely ill even if you do get COVID-19. What to expect during and after the vaccination. Before, you should learn about the vaccines available and see if it is recommended for you. You can always check newyork.gov for eligibility. During, read the fact sheet that tells you about your specific COVID-19 vaccine and receive a vaccination card. After, expect some side effects, enroll in V-Safe, and continue using all the measures to protect yourself and others. The combination of getting vaccinated and following CDC recommendations to protect yourself and others offers the best protection from COVID-19. That is why, regardless of if you are vaccinated or not, all policies and protocols established by Habitat Dutchess must be followed. These also include covering your nose and mouth with a mask, staying at least 6 feet from people who do not live with you, avoiding crowds in poorly vented indoor spaces, and washing your hands. Protect yourself, your family, friends, coworkers, and community. Get vaccinated. Choose to get vaccinated when it is offered, and share your experience with coworkers, friends, and family. You can even show that you received the vaccine by wearing a sticker or button. For more information about the COVID-19 vaccine and all protocols, you can always visit thecdc.gov, contact Jen Radicone at Habitat Dutchess, and to check for your eligibility, check newyork.gov. After vaccination, remember, you still need to cover your nose and mouth, stay at least 6 feet away from people, avoid crowds, wash your hands, and clean and disinfect frequently. Local vaccine information. For information on vaccine appointments and eligibility, please visit newyork.gov. If you prefer to call via telephone, please dial 1-833-New York State 4VAX or 1-833-697-4829. Finally, if you are an eligible senior citizen, you can also call a local line, 845-486-3555. Select option 1, listen to the menu, and then select option 2. This should connect you to the Office of the Aging, and you can be added to their notification list to receive a phone call when vaccines are available, according to NewYork.gov. Here are the CDC COVID-19 vaccination websites. Thank you for attending this training, and please be sure to click the link in the original email to acknowledge that you have viewed this training. Have a great day, and thanks for being a part of Team Habitat Dutchess.